Hi, I'm Jenny Barker, naturopath and health educator, and today I'm going to talk to you about some key nutrients that are absolutely essential for you to have good health, yet it is really common for them to be low. And these nutrients are minerals. So I'm going to talk to you about the symptoms you may be experiencing if you have low levels of minerals. I'm going to talk to you about what diseases you might be putting yourself at risk of, and what might be causing you to be low in your levels of minerals. So minerals are needed for our body for hundreds of functions. So minerals like magnesium, zinc, chromium, selenium, and iodine. Mineral deficiencies are really common, and I can't count how many clients I have seen who have a deficiency in the mineral zinc. So as a result of being zinc deficient, some of them have issues with their digestion because they can't, if they don't have enough zinc, then they can't make enough hydrochloric acid, which is needed to break down your protein food properly. And you also need zinc to make your digestive enzymes, which helps you to digest your food. So other common symptoms from being deficient in just this one mineral, zinc, include things like bloating, eczema, acne, rashes, missed periods, infertility, low moods, poor memory, struggling to cope with stress, or low immunity. So, starting to pick up all the bugs that are around. And so this is why zinc is absolutely key. And these symptoms are, all from just not having enough of this one mineral, zinc. So there's many other minerals that are essential for good health as well. So I'm just giving you an example of this one mineral. So selenium is also very important. It's another mineral, and it's very commonly deficient in New Zealand and Australia because it is so low in our soils. So selenium is important for your thyroid function. So a sluggish thyroid can cause you to gain weight and feel the cold. Selenium is also really important for heart function, and there are a number of cancers that are related to selenium deficiency. High cholesterol is also something that can be a result of being deficient in selenium. So magnesium is another key mineral that a lot of people are deficient in. And so symptoms of being deficient in magnesium include things like insomnia and unrefreshed sleep. Some people might get heart palpitations or fluid retention, or you could get a shortness of breath, or maybe painful periods, constipation, irritability. You could get tired from being low in magnesium, muscle cramps, or you could even get high blood pressure. So you can see just how many health issues that you can get from not having enough minerals. And there are other essential minerals which are common for people to be deficient in as well. And these can cause their own set of health issues if your body doesn't have the optimal levels that you need. And so these minerals include chromium, iodine, iron, and calcium as well. And unfortunately, we can get low in these minerals even if we are eating a healthy diet. And I'll explain more about this in a moment. So there's a number of factors that can cause us to be low in minerals. And so if our soils are low in minerals, then therefore it's not going to be, the minerals aren't going to be at good levels in our fruit and vegetables. So if the soils are low, we can't be eating these fruit and vegetables that are high in minerals. We can have issues with absorption of these minerals. So we can get malabsorption due to inflammation in the lining of the wall of your intestines, which can be from an inability to break down your food properly, or it could be from food intolerances, which could also inflame your gut. Or things like medications can cause malabsorption, and they can block the uptake of minerals or cause a loss of minerals. So medications like the oral contraceptive pill, ACE inhibitors or beta blockers as well. So stress can also cause us to have low levels of minerals. And then if we are not eating enough whole foods, if we don't have a whole food diet and instead we're eating processed foods that are high in refined carbs and low in nutrients such as minerals. Minerals can also be blocked by heavy metals, and we all have a load of heavy metals. It's just most people don't realise that. So we all have some mercury and aluminium and lead and chromium, cadmium in our bodies. Now we go more in depth about minerals and other key supplements in the Health Reset program, but I just wanted to let you know how important minerals are for good health. Now, one of my mentors called Dr. Bob Marshall, he was a mentor that I had over the years, and he was a very successful nutritionist in America. Now, he saw over 50,000 patients, but he said there were two main factors that people die from, and that is poor digestion and a lack of minerals. So meaning that these two things are what is underlying conditions that people die from, like heart disease, strokes and cancer. So please make sure you're eating a diet that is full of high mineral foods like your vegetables, your fruits, nuts and seeds, whole grains, legumes, fish and meat. And get yourself a good multi-mineral supplement that has good levels of minerals in them. So for example, for a mineral like zinc, you're going to want to have a minimum of 15 milligrams per day. However, some people do need a much higher dose of this. But you'll see that many of the multi-vitamins that they have at the supermarket don't even contain this minimum dose. So minerals are just so important for every process that happens in your body, and you can't have optimal health unless you have the right level of minerals for everything to function properly. So I hope you have found this helpful. Bye for now.